So I do want to just thank you again for coming to the GENETWORx PGx and Mental Health Symposium. My name is Kim Locklear, and I will be the host for the evening. Thank you all for coming out to learn about the pharmacogenomics and mental health, both important topics because mental health disorders are being diagnosed in unprecedented numbers in our country, both prior to and during the pandemic. Choosing the right medication to treat mental health conditions as well as a variety of other medical diseases can be difficult as every person's body and genetic makeup is different. The process of finding the right drug can be painful, frustrating, and time-consuming for families, doctors, treating both psychiatric and medical diseases, and are in need of tools to assist in determining which medications and dosages are right for their patient. With conditions such as depression, anxiety, and ADHD, as well as medical diseases, trial and error medication can delay treatment and can cause the family and patients to feel hopeless. Finding the right drug can also be dangerous, as nearly 5% of deaths in the U.S. are due to drug toxicities. This gap in healthcare services can be bridged with pharmacogenomic or PGx testing. This type of testing can assist doctors in finding the right medications and the right dosage based on the patient's DNA. Also called personalized medicine, PGx testing is now in the spotlight with a bill recently introduced in the U.S. House of Representatives called the Right Drug, Right Now Dose Act, which seeks to accelerate education and the use of pharmacogenetic PGx testing to help prevent adverse drug reactions and to facilitate the integration of drug response-related genomic information into patient care. We have an excellent panel tonight. We have experts from GENETWORx that will discuss how PGx works and how it can benefit patients.
Good evening. My name is Tana Kafer. I am a pharmacist and the Director of Clinical Services at Bremo Pharmacies here in Richmond, Virginia. And I'm here to share some of my boots-on-the-ground experiences while conducting pharmacogenetic counseling and testing in my pharmacy, in our community pharmacy. We began offering PGx testing in 2017, and as Marianne so eloquently painted the picture, we had to stop for a couple years during COVID. So we're very excited to be picking up this service again and partnering with GENETWORx. I feel like as a pharmacist, much like Stacy, I am uniquely positioned to recognize when patients are not using their medications correctly or are experiencing adverse drug reactions that are directly affecting their health. In my role as the Director of Clinical Services, I spend most of my time in pharmacy consulting. So I help patients manage chronic disease. I work through and help them understand complicated drug regimens and help solve drug-related problems through my extensive consults with my patients both in and out of the pharmacy. PGx testing was the perfect tool to add to my toolbox, just as Stacy said. And that's truly what it is. It's a tool to use with other diagnostic tools to make you as providers more successful in choosing an appropriate drug therapy. I had a patient come into my pharmacy very frustrated after a sports injury, and she had been tried on multiple pain medications with no relief. She was now suffering from depression as a result of her untreated pain, and she was coming to me for a pharmacogenetics test because she was sick of wasting time and she wanted to get to the bottom of what would be the best therapy for her. I performed the test. When she came back, the results revealed that she was a CYP2D6 poor metabolizer, which has been explained by both of you all. So you know that this means that she would not experience adequate pain relief with some pain medications. So in short, the doctor treating her pain misinterpreted her lack of response of different medications as potential drug-seeking behavior. This test performed in our community pharmacy helped validate what the patient had been feeling, and it was the first step for her to recover and finding that right medication, not only to treat her pain, but now her depression. A majority of the patients I see in my practice that are seeking out pharmacogenetic testing, they want to have a better idea of what mental health drugs would be the best fit. So I always say it's not the end-all be-all, but it is a place to start. It makes them feel more confident and more comfortable with drug therapy, or it's a validation for those patients who have tried and failed multiple therapies to be like, that's why. It's not me. I'm not the failure. I just don't process these drugs the right way. And this can be life-changing in this population. Similarly, I've had consults with concerned parents whose children are struggling with ADHD, autism, and they're concerned or scared about starting any medications in their child. And also, sometimes those children, by the time they get to me, have failed multiple medications. And as a parent, that can be heart-wrenching, because what your child thinks they're a failure. They're not a failure. The medicine was not right for them. And so doing a pharmacogenetic test helps provide that starting point and clarity for drug options to help promote success for you as physicians, me as a pharmacist, in recommending the medication that would be the most helpful for that patient. I was doing a chart review on a patient I follow biannually in an assisted living facility. This patient had suffered a stroke since my previous visit and had been started on clopidogrel. This picture has been painted before. My 6-month review, I came back, the patient had had another event, still on clopidogrel. And so I reached out to the doctor and said, you might want to try to do a pharmacogenetics test in this patient, because as we know, CYP2C19 intermediate and poor metabolizers, clopidogrel is not going to be effective for these patients. So this is, of course, a much more common, known, well-researched polymorphism, but it was missed in this case. And so because of the test and my recommendation, this patient's therapy got changed. As a pharmacist, I look at drug therapy through a very different lens. When a patient comes to me with a problem, I immediately think that it's medication related until I can prove otherwise. I like to dig in, I like to explore the medications, what they're feeling, and PGx testing has been such a great asset to add to our clinical services at Bremo Pharmacies and has led to better outcomes in our patients. In addition, we've developed wonderful partnerships. Dr. Furman's sitting in the audience right now, and he has worked with us for many, many, many years in many, many different ways. But it's wonderful partnerships with providers across the area that collaborate with me and us as a pharmacist, me as a pharmacist, Bremo as a pharmacy, to take the best care of our patients. I would love to see PGx testing become more mainstream, as we all would. This medical blueprint can be used by patients and providers throughout their lifetime. It's not just one time. When I think about the triple aims of CMS and our world of value-based medicine, quality measures, PGx checks all those boxes, right? So first, improve patient care through patient safety and quality patient experience. Patients get the right medication on the first try. That builds trust and loyalty with you as a provider. Check. Efficient care and reducing cost. PGx testing empowers patients and providers with the information to make more informed decisions to save both time and money. Check. And the third, improve population health. When patients are on the right medications, they're more likely to take those medications. And of course, this is going to improve your chronic care management and your outcomes. Check. This is what I call a win-win-win.
It is my honor and pleasure to be here with you this evening to give you an opportunity to help change and save the lives of your patients. So let's go to slide 3 and look at 5 scientific facts that PGx can prevent. So fact 1, adverse drug events send more than 4 million Americans to a physician's office or emergency room each year. An estimated 20 to 50% of individuals with depression do not normally respond to the drug treatment and dosage. This is largely in part to a gene called SLC6A4 that's responsible for serotonin transport. So it's really important to know how your patient transports serotonin before prescribing an antidepressant. Approximately 35 to 40% of adolescents and children will not respond to the initial antidepressant, and for the elderly, a complex medication burden contributes to difficult to treat depression. And I want to just stop right here and share a case study with you about an elderly patient who was removed from 4 long-term care facilities because of combative behavior. She had a PGx test done, she was put on the right medications, and now she's living contently in a long-term care community. PGx is a tool that can help stop these heart-wrenching stories. Codeine, a widely prescribed opioid, can cause severe toxicity in ultra-rapid metabolizers. Most of the studies that I have read, the severe toxicity can quickly turn into death, and especially among children. And then the opposite may result, in ineffective pain management and poor metabolizers. Improper Rx prescribing leads to increased healthcare costs, reduced healthcare professional productivity, and reduction in patient safety and overall quality of life. So GENETWORx comprehensive test covers over 600 medications within 15 categories. So I'm sure if you look at some of these categories here, you have a family member that's taken a medication that falls into one of those categories. So let's take a look at what type of patients would benefit the most from PGx. So patients who have tried and failed a medication for their condition, patients worried about developing side effects to medicines, or those who already have had significant side effects to past trials of medicines, and patients with comorbidities. These patients are usually on multiple medications, and polypharmacy is a major concern. And then just patients interested in learning more about their genetic blueprint. This is a once-in-a-lifetime test, so you want to make sure you get the most comprehensive test available. So why PGx with GENETWORx? So PGx can increase patient safety, the ability to utilize GENETWORx PGx report for current and future medication management, selection of optimal drug therapy, improvement of treatment outcomes, and reduction in healthcare spending. And you have the opportunity to perform this test and choose a lab that will give you the entire picture, not just a snapshot. So we have 8 sections to our comprehensive report, and my personal favorite is the pharmacy section. A PharmD PGx expert looks at every single one of our reports. They include the latest guidelines from CPIC, Dutch Working Group, PharmGKB, and they also include the effects of inhibitors and inducers. So now Stacy, our PharmD expert, will take you into a deep dive of the report.
As Mary Ann mentioned, PGx relies upon genetic testing to study genes specifically involved in metabolizing and transporting drugs throughout the body. So I'm sure you were wondering, what exactly is this test and how can I use it for my patients? At GENETWORx, we offer a 32 gene panel and focus on how individuals' DNA influence their response to medications. So in practice, I'm sure there are times when you've had patient A and patient B with similar objective profiles. Maybe they're the same age, same sex, same body type. They both have the same diagnosis, similar symptoms, and you prescribe them both the same medication at the same dose. So instead of general questions like, how are you feeling today? You could look at this and use this to say, have you felt differently since taking your bupropion? Have you felt improvement since starting your bupropion? Or when you take your bupropion in the morning, does it last you all day? How are you feeling in the evenings? Because you know that the patient is a rapid metabolizer and we wanted to monitor for efficacy, it can help guide that conversation a little bit more in the direction of making sure that your patient's getting the response that was expected.
Well, we wanted to thank you tonight for your participation from our GENETWORx PGx and our mental health symposium. We hope you had a wonderful time tonight, and if you do have any questions, your presenters here will have their card with them as well to follow up with any information that you may have. We do hope that you had a wonderful time, and please drive home safely.